The following is brought to you by VerticalVet. Rethink your GPO.
Hello, Vertical Vet family. I am Dr. Ernie Ward, Chief Veterinary Officer, and it is my pleasure to bring you once again another episode of Vet Med School. And today, we're going to talk about a topic that is going to be on everybody's radar for the next several months, and that is feline osteoarthritis. Now, to date, we really haven't had great therapeutic interventions at our disposal, right? So we would see these poor cats that were suffering from arthritic pain, and there was very little that we could do. Well, all that's about to change. We're about to have the world's first approved medication for this. And today we're going to talk about that, but a whole lot more on how you can begin to become more cat-centered when it comes to your OA programs in your clinic. And today we are fortunate to be joined by Dr. Margaret Gruen from North Carolina State University. Now, Dr. Gruen graduated from the University of Illinois College of Veterinary Medicine, and she did her internship and residency there, and she did a PhD in comparative biomedical sciences at NC State. So again, she went from Illinois to NC State, where she focused on the assessment of pain in cats with degenerative joint disease. But that's not where her work really got interesting to me. She then went over to Duke University, and let me tell you, that's a fantastic program, where she did a postdoc over there at the Canine Cognition Center. Now, many of you have seen their research. It's been published widely around the world, both in the medical and the lay press, and she was part of that team that really, I think, established what we should be looking at when it came to canine cognition. She's board certified by the American College of Veterinary Behaviorists, and she focuses her research now on the human-animal interaction, which is why we're going to be talking about these things today. Particularly, she wants to talk about how do we qualify and quantify chronic pain and the effects of pain on how we interact with our pets. So, Dr. Margaret Gruen, thank you so much for joining us.
Thank you. It's really a pleasure to be here.
Well, listen, again, a lot of people have been talking about feline osteoarthritis. I mean, there's been rumors about a drug coming out from Zoetis, and so a lot of us are saying, wait, what is this all about? But today we want to focus our conversation not just on the pharmacologic advancements that we are going to talk about that, but we also want to talk about how we can recognize and even some of the non-medical interventions that we can do, right?
Yes, it's one of my favorite topics to talk about, so I'm really excited to be here to talk about that today.
Well, Dr. Gruen, I know that at the outset, many of our Vertical Vet members all across the country are saying, okay, but I thought this was about Solensia, the drug. Before we can talk about that, there are, as you can imagine, Vertical Vet family, some disclaimers. So maybe let's go ahead and just explain a little bit about what we can talk about with Solensia, what we can't, and why that's important, okay?
That sounds great. So yes, with the approval of Solensia, which is a frunevetmab injection, we now have an option to provide some long-term control of the pain associated with osteoarthritis in cats older than 12 months of age. So this is a felinized monoclonal antibody. It's administered once a month subcutaneously, and the target for Solensia is nerve growth factor, or NGF, which we now know to be really important in causing and perpetuating pain associated with osteoarthritis. So why don't we show that important safety information slide too? So while the purpose of our discussion is obviously not to dive into the safety and efficacy studies that led to the approval, it's important to highlight some of the important safety information as you see here on this slide. So of note, since NGF is needed for proper neonatal development, Solensia should not be given to pregnant, breeding, or lactating cats, and pregnant women or women trying to conceive and breastfeeding women should take extreme care to avoid accidental self-injection.
That's right. And again, guys, if you have additional information, it's going to be forthcoming both from Vertical Vet as well as Zoetis, but we have to get that legal stuff out of the way. Well, again, I think at the top of this discussion, because again, we want to get into a lot more, but I know that people are like saying, okay, so there's this new medication. So in briefest terms, maybe we can just look at how hard it's been historically to diagnose osteoarthritis in cats. So maybe talk a little bit about the natural history and just the normal behavior of cats and how we can start to identify those early signs maybe of OA.
Great. Yeah, so it has been really difficult for the diagnosis of cats, for the recognition, for a variety of reasons. One, that we don't see cats as often in the clinic. Two, that when they come into the clinic, they don't display their natural behaviors, so it's really hard for us as veterinarians to recognize some of the signs. And three, it was really hard for owners to recognize what signs were associated with pain. So things that they might have seen, changes they might have seen in their cat, they didn't recognize that those might be associated with a painful disease and one that we might be able to treat or impact in some way. So that has really been historically very difficult, but there's been a lot of work to understand what are those behavioral signs that cats show us in the home and in the clinic that can help us recognize those. And when we understand a bit more about cats and their natural history, how they behave normally, that can help us inform what we should be looking for, right? So we know that cats are solitary hunters, and they don't always display their pain the way we might expect in a dog.
Yeah, and I think that's really important because I think sometimes Vertical Vet family, we think that we already have done all the studies. We know all the science. We understand pretty much everything there is to do in vet medicine. But I will tell you, Dr. Gruen, when it comes to feline behavior, I still think we're a bit of dark ages, So explain to us a little bit about some of the studies that maybe you've been familiar with or others that could help inform us on what these 5 pillars of the behavior and environment, all those needs. Because I think that again we're still early on in our understanding, and we're learning now to recognize a lot of developments past decade, as you mentioned. But like, what do some of these studies look like, and what are we trying to achieve here?
Yeah, so some of the studies that have been done have really looked at what are the behaviors that owners can recognize, that they detect, that are ones that reflect change when cats receive an analgesic. So when they're no longer painful, what are the ones that they can see change? And when we think about kind of what cat needs are, that can help us pick out those behaviors, look for those behaviors. And so those have been studies that have been done by various groups, including our group here. So understanding that, cats have this flexible social structure. They use vertical space to really share resources within the home, to share with other cats in the home, to get away when they need to. So that vertical space being a really important one. And so the way that cats start to jump up or jump down or move around their environment can change a lot when they're in pain. And so those are the things that we start to look for. I mean, one of the things that's a really key thing is that cats with osteoarthritis pain don't typically limp. So we're looking for something that cat patients don't always show because they develop more bilateral disease. And so we see, instead of an offloading of one limb, we actually see a slowing down in general, or a change in how they're doing some of these really important activities. And some of the studies have shown, that there are really key activities that we can identify that are altered in cats with OA and OA pain.
Yeah, so what are some of those key things to look for? Because we mentioned, like you said, clinically they don't often present with unilateral lameness, which is a hallmark for everybody. And cat owners go, oh, they're not limping, but they
Right.
are displaying certain things. And again, this goes back to their ascent into vertical spaces, because now they've got to use both hind limbs to propel themselves upward or climb. So maybe, again, what are some of those things that we should be telling pet owners to look for?
Exactly. So we did some neat work looking back at cats with OA and without, and what were the activities that really were able to discriminate between those two groups. And the 6 that were really the most important were how they jump up, how they jump down, how they walk, how they run, how they go up and down stairs, and how they chase or play with an object. And so those are the ones that we want to understand and have owners be watching for. But it's not enough to just ask them, for example, if we just ask, do you think your cat is in pain? We'll get back a response that's, no, I don't think that my cat has any pain, because what they're picturing for pain is very different. Either they're looking for that unilateral lameness, or they are picturing something much more extreme. So we know that there's kind of this heavy weight on looking for vocalization, or really avoiding doing things, or not eating, things that would not really be associated with chronic pain. Those are really extreme pain behaviors. So we want to ask them about how they're doing some of these behaviors that are impacted by pain.
Yeah, and again, these are insidious and gradual in onset. So many times by the time we see that cat, it's like they've forgotten, oh yeah, there was this one moment when things suddenly changed and I've, it seems normal now. Everything's normal. And again, Vertical Vet members, I think this is a bit like the early days with Rimadyl, right? At that time, I don't think we were doing a super job with OA in dogs. And people would come in and we would say, is your dog in pain? They'd be like, no. And you'd be like palpating the hips or whatever, and they wouldn't be crying out, and they'd go, see, he's fine. And I think we're going to have to somehow elevate the conversation once again to look for these very subtle, gradual onset of symptoms. So again, where I get, I try to tell vets, especially, with my work in obesity and nutrition, Dr. Gruen, it's one of those things where we are really looking for these subtle signs. They can be significant. And so suddenly now the cat who can no longer jump on the counter, right? And jump on the couch, doesn't get on the bed at night. Like those are the little signals. Again, if you're expecting the cat to cry in pain, chances are it's never going to happen. So what are any other little subtle, nuanced symptoms maybe that you look for that we could benefit from?
Yeah, so I think we want to try to get them before they've stopped doing those activities completely. I hear people tell me, well, I finally, after 12 years, trained him not to jump on the counter. Well, no, that's probably not what's going on, right? So we actually are really interested in how they jump up on the couch before they've stopped jumping up on the couch. So what we'll see in cats with OA pain is that they won't clear the jump completely. They'll hesitate before doing it, and then their back legs will hit as they get up onto it. Or for cats jumping down, they'll reach way down along the side and then almost land on all fours as though they're trying to cushion the blow. When they're going upstairs, we'll see them lead with one paw and just go one step at a time or stop in the middle. Bunny hopping is something that we'll see a lot. And so we really want owners to be paying attention to those signs way before they completely stop doing those activities, because they'll keep doing them for a long time. It's how they do them that changes. And that's the point at which we can intervene and really help. So we don't want to get to the point where they, are not coming out from a one bedroom, or they're no longer visiting their owners in the evening. We want to catch them before that. Part of the problem is that we don't see them doing those normal behaviors in the clinic very well or very often. So we really have to engage with owners on what they should be looking for at home, what it will look like, and getting them to watch their cat doing these things that they might not have been watching for before.
Yeah, I can't agree more. I will tell you guys, having been a veterinarian for over 30 years, you rarely diagnose this in the clinic on a cat. Of course we do in extreme cases, and I've had those cats that leap off the table when I go to palpate or extend and flex the hips. But most of the time, that's too late. Let's be honest. And we're trying to determine this at home earlier than that. And so this is why I think, Dr. Gruen, I know you've helped develop some of these tools, and a lot of other people have helped Zoetis develop tools that pet parents, that cat parents can actually use to say, okay, here's maybe a checklist of things. So let's talk a little bit about that. I think for me, this has always been a pre-visit, pre-exam sort of awareness. So any tips on like how a vet could say to a cat owner before they come in, hey, tell me if these things are happening at home?
Yes, so there is a checklist that's been developed that was based on that work that we did looking at those activities that discriminate between groups of cats. That checklist includes some really neat animations that show both an animation of a healthy cat performing those activities and a cat with OA performing those activities. So owners can really see that. I think that comparison, that contrast is really powerful for people to be able to detect, oh yeah, that is how my cat is doing that. So as you said, it's a really chronic, progressive disease. You kind of forget how your cat used to jump down. And then when you see that comparison, that can be really powerful. We also really advise people to bring in videos of their cats performing those activities. Now everybody carries a video camera around in their pockets at all times. And if they're given clear instructions about what activities we want to see, they can bring in something that's short, that actually gives us a ton of information really quickly and can help us kind of target even our OA exam. So even our orthopedic exam can be targeted when we see these videos and can see what activities the cats are doing and how they're doing them. So yes, having people look at those animations, do the checklist in advance, be thinking about it, but bring in a quick video of their cat going up the stairs, going down the stairs, jumping up, jumping off, walking and playing if they'll play. All of that gives us really quickly a ton of information that we'll never get in the clinic.
Yeah, and Zoetis is going to have tremendous tools and resources for us as clinicians to help guide us and to really, I think, inform and make awareness more prevalent amongst cat owners. I also want to talk, before we kind of move over to how we treat and diagnose and so forth, a couple of other key things. Number one, I think that sociability is an issue with cats that are experiencing chronic pain. And I mean, this is kind of right in your wheelhouse, but I would chronically see these older cats, and the owner would say things like, "Oh, she's gotten very ornery," or "She's very particular about where I pet her these days." And to me, I always read that as a potential pain signal, right? I mean, so what about sociability, human interaction? I mean, I know that's a focus of your research, but any other tips or things we should be looking for when it comes to how we interact with the cat?
Yeah, that's a great question. So, in that work that was able to distinguish between those two groups, those behaviors really came out as ones that change in an individual cat. So, there are tons of reasons for cats to be more or less social, just kind of temperamentally. But when we see that change in a particular cat, that definitely can be a sign of pain, something that we want to follow up. So, a cat who was very social and is now more aloof, again, as they can't access some of those areas where they may be using them to get away or that are comfortable resting spots. They may just stay in one area more, so they're less social. And as you said, that certain areas may be uncomfortable. And we know that with chronic OA pain, we see a ramping up of the entire somatosensory system, right? So it's not just that joint hurts, really everything starts to hurt more. And so that can contribute to that kind of what owners are interpreting as orneriness, but really is discomfort.
Yeah, I love that. And one thing too that I've heard you speak on multiple times when it comes to recognizing pain in cats is, I think I credit you with this, so you can tell me if I'm crediting you incorrectly. But you're the one who always said, where are they looking when they jump, right? And so I think a lot of us had been doing that intuitively, especially with dogs, because we used to always do the sort of the step test. If the dog hesitates before just bounding up the steps, they go, "Oh my gosh, I got to go up or down. Oh no." But with cats, you mentioned looking, like what are they doing, and that hesitancy. So maybe describe that a little bit more, because I think it's more prevalent than maybe I've given it credit for.
Yeah, we definitely see that they'll hesitate more, they'll look down before they'll kind of look around for the right spot to jump down. It just takes a lot more effort than what you think about, what you imagine with cats and that sort of smoothness of leaping up and leaping down. You do see them kind of planning that jump almost. Another thing that we sometimes will see is scratches in the bed or in the couch that are not from them scratching on it, but from them scrambling up with their back legs. So they plan these jumps, and then when they can't make them, you'll see the evidence of that as well.
Yeah, I love that. And again, Vertical Vet family, the reason we're having this discussion and we're going to extreme detail is because most of the cat parents are not recognizing pain. And so we're trying to now give you little tips to say, where does your cat look before they jump? Or, are the scratch marks on the bed where they're trying to scramble up or whatever? I mean, those are really important. I'll tell you another thing too, Dr. Gruen, I used to tell my cat owners, do they miss their jumps these days? And a lot of times we used to attribute that solely to muscle weakness, which is, fair in older cats, but regardless, I think a lot of times those are associated with pain as well. Like just suddenly they miss, or they just don't do it. Now, the other thing too that can be perplexing and complicating matters is that these are often older cats. So now we may be dealing with kidney disease, a UTI. I mean, we have thyroid. I mean, a whole cascade of issues, heart conditions. So what are some of the tips that you would give to distinguish between what would be a pain response versus a pure physiological condition, a chronic disease?
Right. Well, obviously, we do all of the necessary diagnostics to understand. I think in these older cats, we kind of can expect that they'll have some comorbidities. And so it's in behavior, we used to talk about ruling out, but actually, I think it's really more about understanding the contribution of to what we're seeing, right? So, what is the contribution of this into the behaviors that we're seeing? Behavior is for sure the best way for us to understand pain. So, if we've looked at and understood where they are with their chronic kidney disease. They're stable. We have evaluated everything that we can. Then, and we feel that it's safe to do so. We really advocate for pain trials for cats as a really quick way often to be able to determine how much of their behavior is due to pain. So if we give them an effective analgesic, we can observe how much of their behaviors change. Again, I really like video for being able to do this, but even some of the standardized questionnaires that we've developed for owners can be really helpful in being able to understand what is the contribution of pain in this behavior that we're seeing.
Yeah, and I'll tell you, Vertical Vet family, obviously Solensia has been out in Europe ahead of the US, and I've talked to countless colleagues over there who repeat the same tales we heard back in the early, Rimadyl type of days, where they go, they're a puppy again. And you're going to hear this with cat owners. You're going to say suddenly they're jumping up on the couch, they're more affectionate and loving. I mean, you're going to see complete change in behavior once that pain goes away. Now, Dr. Gruen, just again, because I'm all about senior diseases, I think it's important to point out that, again, these things coexist. So you can have kidney disease and osteoarthritis. You can have heart disease and osteoarthritis. In fact, chances are you're going to have a whole multitude of conditions. So I don't want people to forget that you may have to treat multiple conditions simultaneously, right?
Right. And so I want to go back to one thing you said there, which was about them being one of the things that we saw over and over again in the trials was people being surprised about what their cats still wanted to do.
Yeah.
It really struck by some of the behaviors that they saw come back in their cats. And that was really moving for a lot of owners. Yes. So that is one thing that we think about a lot is the caregiver burden and the kind of cat owner burden, that dyad, that relationship that's so important when we select treatment. So if we are treating multiple comorbidities, we want to think about how many oral medications are we asking owners to give? What is it that we're asking owners to do? And how do we make sure that we balance the quality of life for the cat and the health of the cat owner relationship? Because we've all seen cat owner relationships get ruined by a course of medication that didn't go well, right? So the cat hears the cabinet open and runs away. And so we want to really think about that when we're treating these cats with multiple comorbidities. How do we balance the number and type of treatments that we're giving them so that we preserve that relationship?
Yeah, and I think one thing too, as we sort of, near the end of today's conversation, because again, we're going to be giving you a lot more information, Vertical Vet members, about specifics of dosing and, how to the treatment regimens and so forth. But today we wanted to get about awareness, right? But let's talk a little bit about the prevalence, because we do tend to think of osteoarthritis as a middle-aged to older, and really in dogs we think of it more secondary to injuries as well. But with cats, it's less so. So talk a little bit about the prevalence, because I think that even though in the obesity world we've been talking about this for a long time, I think still veterinary professionals are surprised when they hear just how many cats actually are, documented with osteoarthritic changes.
Yeah, it is remarkably high. So there have been a couple of really good, extensive prevalence studies that have been done, and all show that a vast majority of the cats over about 10, 12 years of age have radiographic evidence of degenerative joint disease or osteoarthritis. So it is well over 80% as we get into those age groups. Of that, probably about half of them at least have clinical signs associated with those radiographic changes. So it is incredibly common in cats. I think what was remarkable in some of those prevalence studies was that even in really young cats, we saw signs of radiographic evidence of degenerative joint disease and arthritis, some with clinical signs, but certainly as we get to about 10 years of age, the prevalence and the severity of the disease goes way up. And so it is, one that we think about in these middle-aged and older cats. But it's not that we need to wait till they're 15, 16, till they're really stopping doing some of these activities. We want to be getting in there in that kind of adult and mature cat stage.
Yeah, and Vertical Vet family, in my early career, you might have heard me lecture, and I would say the most efficient musculoskeletal system on the planet in terms of mammals is the feline. And now what's happened is not only, we learn there's maybe some caveats to that, but we have now obesity and other conditions that compound it and actually accelerate these changes. Now, of course, you guys know my passion for combating pet obesity, but let's also talk about, I think what's going to happen, Dr. Gruen, is when Solensia is widespreadly available, then suddenly vets are going to say, okay, we got this covered, right? And they're going to forget that there's a lot of other non-pharmacological interventions that are necessary. And again, I'm going to be the first to raise my hand and say weight loss and maintenance of a healthy body condition. But talk about some of the other things that we need to be doing concurrently with Solensia, perhaps.
Yeah. So, and weight loss is often one of those kind of earlier ones, right? Because in cats, we'll see that increase in weight and then sort of decrease later. And so weight loss will depend on where the cat is at that time, but is really important for decreasing both the mechanical load on the joints, but also the inflammatory effects of obesity. So that one is a really big one. But then we really have to think about the other things that are important to cats. So that vertical space is really important for their quality of life and their well-being, being able to get away. So when they can't jump as high or can't do it as quickly, we need to build in ways for them to be able to access some of those preferred resting areas. So that may mean we put in stairs or ramps or intermediate jumps. We want to make sure that we preserve access. We know that cats will roam all over the home, but they spend a big chunk of their time in their core area. So where they hang out about 50 to 75% of the time. And so we want to make sure that those resources are in that core area. And as they have chronic pain, that core area may change a little bit. And so we need to be reevaluating that. Where are they spending their time now? Do we have the resources for them in those areas? So environmental changes are a big one. I think we often talk about litter box in cats with OA and the difficulty in getting in the litter box. Sometimes we can see not using the litter box associated with some pain. And so making sure that the litter boxes are both in a space that they can access easily, so they're not, down a whole big flight of stairs into the basement, but also that they have low entry for them. So we really advocate for the do-it-yourself litter box or the sweater box that can go under the bed, where the cats are easily able to get into and out of it and position themselves in the box. So making sure that all of those resources are distributed, that they still have their social interactions with people, that, really those environmental changes can make a huge impact on their quality of life.
Oh yeah, these accommodations, they change everything for most of us. So I would just say again, every time when we get a new drug or new treatment, especially something as highly efficacious as Solensia is going to be, sometimes we forget all the other stuff, and we can't forget all the other stuff because that's actually paramount to our long-term success. And, so again, I'm always going to be about weight management. I'm always going to be about, environmental accommodations. The litter box is, obviously we talk about this ad nauseum, but it is if you see a middle-aged to older cat and they're having litter box aversion, don't forget pain, right? Because that's one of those, and it breaks my heart because I've seen too many cats and they're like, no UTI, kidneys are fine, thyroid's okay. I don't know what it is. He just doesn't like to use the litter box anymore. And it's like, no, he's hurting or she's hurting, right? Yeah. So, okay. So now, again, as we wrap up today's conversation, is there anything you can tell us about like the treatment? I know you've been involved with trials and so forth, but maybe just give people a little bit of some insight into what it looks like, what the treatment looks like, and some of the responses and so forth.
Sure. So there are a variety of things that people have used to treat OA and OA pain in cats based on what we've had in the past. So NSAIDs have been used, and gabapentin certainly used, amantadine has been used. With Solensia and the trials that we did here, I can speak from a personal standpoint as well. My cat was part of the initial trial, and I was one of those owners. I was even doing the trial, and I was surprised by some of the things that she started to want to do again, that she would do again. So it really was remarkable for her. I think, it's a once a month treatment. So it's administered by the veterinarian. So the cats will come in and have the treatment given, which both removes that owner piece of giving them medication and also makes we know that compliance is there if we're actually administering the medication. So I think it's really going to be an amazing thing for cats, and I'm extremely excited about it.
Yeah, and again, monoclonal antibody therapy, guys. I mean, you've heard me talk about this for the past several years here and elsewhere. I mean, it's just changing the way we treat so many chronic conditions, and this is just another target that is a perfect hit for Solensia. So I'm super, super excited. Again, Dr. Gruen, I can't thank you enough for sharing some of your experience and expertise around Solensia, but more importantly about raising the awareness of osteoarthritis in cats. So any other last bits of maybe advice or maybe some kind of, inspiration for that veterinary professional out there who's going, okay, I don't know, I'm not sure if I understand this, or I don't think I see any cats with pain. Any last bits of advice for them?
Yeah, I think my top things are to get those videos. I think they're really great. I think they help us be able to get more and more practice at seeing these normal behaviors and abnormal behaviors in cats and get really comfortable with what kind of the range of behaviors are. So I really recommend getting those videos. I say try it. I think being able to see those changes will be really remarkable. And for owners who may not be sure whether pain is a part of what they're seeing, we'll know after you give them a treatment. We'll be able to see those behaviors change and know. And then I'll say one last environmental thing for cats, which is heated beds. I think those are great for our cats with arthritis.
I love them, and they're easy to manage too. And it's not like the old days when I was like terrified of, oh no, it's going to get a hot spot or something. But and again, if they're moribund, I mean that's a different issue. But for cats that can still ambulate and get up, I mean they're great, and there's some super safe ones. Golly, I got to tell you, I'm so excited about this. And again, I think what I'm hearing from Dr. Gruen and colleagues around the world is that if you can get that cat in and you can give them that first injection of Solensia, everything is going to change for that cat. I'm just so excited about this. I can't wait for you guys to get it.
Yes, me too. I am very excited.
Well, listen, thank you so much, Dr. Gruen, for spending some time with us today.
Thank you so much for having me. It's really always fun to talk about cat behavior.
It is. Well, Vertical Vet family, that's it for another edition of Vet Med School. I can't thank Zoetis enough for not only sponsoring Dr. Margaret Gruen, but also for bringing us tools like Solensia. This is actually a game changer, and I don't like that term, but this is going to change the game when it comes to treating pain in cats. So I'm super excited to get this out there widely. I think that millions of cats are going to benefit in a positive fashion. We're going to extend longevity and quality of life, and that's what it's all about. So again, thank you to Dr. Margaret Gruen from North Carolina State University College of Veterinary Medicine and Zoetis for sponsoring this. On behalf of the entire excited team at Vertical Vet, because we are so excited ourselves about Solensia, I want to thank you. I am Dr. Ernie Ward, Chief Veterinary Officer. We will talk to you soon. Bye.